The anxious resistance. Today I'm talking about Solank. Now, Solank is a synthetic peptide that has been shown to have various benefits for the brain and for mental health. It is derived from a natural peptide called tufsin, which plays a role in the immune system and the central nervous system. Solank is widely used in Russia as a medication for anxiety disorders, but it is also considered a nootropic or cognitive enhancer because of its effects on memory, learning, and mood. In this video, we will explore what Solank is, how it works, what evidence supports its use, what side effects or risks it may have, and what are its pros and cons. So first off, let's dive into a little bit more detail about what Solank is. Solank is a heptapeptide, which means it consists of 7 amino acids. Its chemical name is TKPR-PGP. It is a synthetic analog of tufsin, a tetrapeptide that is produced by the spleen and stimulates the immune system. Solank was developed by Russian scientists in the 1980s as a way to enhance the effects of tufsin on the brain and central nervous system. Solank is administered as a nasal spray or an injection. Okay, so let's talk a little bit about this history. You've heard me mention a couple of times Russia. So this was invented in Russia. It was created by researchers at the Institute of Molecular Genetics of the Russian Academy of Sciences in Moscow. They were interested in the potential of tufsin as a regulator of both the immune system and the central nervous system. However, they found that tufsin was unstable and rapidly degraded in the body. So they modified its structure by adding 3 more amino acids to make it more resistant to enzymes. They also tested various analogs of tufsin and found that one of them, called TP7 or Solank, had the most promising effects on the brain. Solank was first tested in animal models and then in human clinical trials. It was approved as a medication for anxiety disorders in Russia in 2009, so it's a fairly recent medication for Russia even. So how exactly does this work? I talked a little bit about it, but Solank mimics the effects of that tufsin on the brain and nervous system. Tufsin is known to modulate or modify the activity of various neurotransmitters such as serotonin, dopamine, norepinephrine, and enkephalins. These neurotransmitters are involved in regulating mood, cognition, motivation, stress response, and pain perception. Solank also influences the expression of brain-derived neurotrophic factor, a protein that promotes the growth and survival of neurons and synapses. BDNF is essential for learning, memory, and neuroplasticity. Solank may also affect the balance of cytokines, which are molecules that mediate inflammation and immunity. Solank may have anti-inflammatory and immunomodulatory properties that protect the brain from damage and disease. So what evidence is there out there that Solank works? Solank has been studied in various animal models and human clinical trials for its effectiveness on anxiety, depression, memory learning, alcohol withdrawal, and other conditions. Here are some of the main findings. And again, you can find these links in the full article that will be in the description for this, so you can go to our website, check out all the links and things that are connected to this article. Solank reduced anxiety and stress-induced behavior in rats and mice. Solank improved short-term and long-term memory in healthy volunteers. Solank enhanced learning, speed, and accuracy in healthy volunteers. Solank alleviated depression and anhedonia, which is loss of pleasure, in rats. Solank reduced alcohol consumption and withdrawal symptoms in rats. Solank increased BDNF levels in the hippocampus of rats. Solank modulated cytokine levels in healthy volunteers. So there is some evidence. A lot of this is in animal studies. I would love to hear more if anybody has experience with this or knows people in Russia who are taking this medication. There's not a lot of evidence in the Western world that this is effective. There's not a lot of studies like in the United States per se about this. I don't know. I don't know a ton about drug development in Russia. I don't know a ton about their process, how valid their clinical trials are, but I do think there are people in Russia who are using this medication. So what are some side effects, adverse reactions, or contraindications for Solank use? It's generally considered to be well tolerated and has no serious side effects or adverse reactions. The most common side effects reported are mild nasal irritation or congestion from the nasal spray, or local pain or redness from the injection. These side effects are usually transient and subside within a few minutes or hours. Solange has no sedative or addictive properties and does not impair cognitive function or psychomotor performance. Solange has no known interactions with other drugs or supplements. However, Solange should be used with caution by people who have bleeding disorders or who are taking anticoagulants, also known as blood thinners, as it may increase the risk of bleeding. Solange should also be avoided by people who are allergic to any of its components. Solange should also be avoided by people who are allergic to any of its components or who have a history of severe allergic reactions to other peptides or proteins. Okay, so overall, what are the positives of potential Solange use? It is natural and safe peptide that mimics the effects of a human peptide. It has multiple benefits for the brain and mental health, such as reducing anxiety, improving memory, enhancing learning, alleviating depression, and managing alcohol withdrawal. It has no sedative or addictive effects and does not impair cognitive function or psychomotor performance. It has a rapid onset of action and a long-lasting effect, which is great. We're really looking for things like that these days. It can be administered easily as a nasal spray or an injection. So what are some of the negatives? Some of the negative aspects or disadvantages of using Solange are it is not widely available or approved in many countries outside of Russia or Ukraine. Again, I don't advise that you get this if you're not in any of those countries. This video is for educational purposes to learn about what is being used out there, what has potential, and maybe this may gain popularity in more Western countries and become available. It is relatively expensive compared to other nootropics or anxiolytics. A lot of that is probably because it's pretty new. Approval in 2009, only 14 years ago, not that long. Again, I don't know a lot about the drug development in Russia, but maybe it's still under patent, maybe it's difficult to get or manufacture, I don't know. It may cause mild nasal irritation or congestion from the nasal spray or local pain or redness from the injection. It may increase the risk of bleeding in people who have bleeding disorders or who are taking anticoagulants. It may cause allergic reactions in some people who are sensitive to its components. So overall, Solange is a synthetic peptide that has been shown to have various benefits for the brain and mental health. It is derived from a natural peptide called tufsin. Solange mimics the effects of tufsin on the brain and nervous system, modulating the activity of various neurotransmitters, increasing BDNF levels, and affecting cytokine balance. Solange has been studied for its effects on anxiety, depression, memory, learning, alcohol withdrawal, and other conditions. Solange is generally well tolerated and has no serious side effects or adverse reactions. Solange has no sedative or addictive properties and does not impair cognitive function or psychomotor performance. Solange is widely used in Russia as a medication for anxiety disorders, but it is also considered a nootropic or a cognitive enhancer. Because of its effects on memory, learning, and mood, Solange is not widely available or approved in many countries outside of Russia and Ukraine. Solange is relatively expensive compared to other nootropics or anxiolytics. It does have some mild to moderate side effects such as irritation at the injection site or in the nose where the nasal spray is administered. Solange may also be contraindicated in those who have bleeding disorders such as hemophilia, heavy periods, those kind of things. Overall, my take on Solange is that it has potential. It is, approved in Russia and Ukraine, nowhere else, so I don't recommend you take this or even, seek it out unless you are in those countries. But it is something that really caught my attention because it is unique in the way that it works, kind of the way it's a natural boost to those neurotransmitters such as norepinephrine, serotonin, and dopamine. Really caught my attention because I personally really like SAMe, which is a medication that I talk about in another video, and it's something that I've taken for a while now, and it's been one of the most helpful things that I have taken for depression and anxiety. These things are always really interesting to learn about. Hopefully it's something that can catch on in the Western world, and there can be more studies here and maybe it can be approved for use in European countries and the United States.